1 in 5 Americans will be diagnosed with skin cancer in their lifetime, and 80% of the cases will be discovered in the head or neck area. In particular, doctors are seeing skin cancers in and around the eyes. It's called periocular skin cancer. Welcome Dr. Usha Reddy with Charlotte Eye, Ear, Nose and Throat Associates. Dr. Reddy, thank you so much for being here today to talk about this. First off, let's talk about skin cancer in general, some risk factors for skin cancer.
Right. So the most typical skin risk factors for skin cancer that we think about, of course, are light skin, fair eyes, and sun exposure, of course. But other things are also heredity, so family history of someone who has a skin cancer, and then smoking as well.
You're seeing a dramatic increase in skin cancer in people under the age of 30. Why is that the case?
That's right. So in fact, in the age group under 30, we're seeing a tripling in the incidence of melanoma, doubling of what we're finding for basal cells and squamous cell carcinomas. And really, I think that part of it is good news because people are just getting screened earlier. So patients are more aware, they're looking for things, there's more awareness in general. So maybe we're catching these earlier, and that's what's causing the numbers to be high. But the other part of it is that, you know, all of us continue to be out in the sun, and tanning beds are still popular, so we're still at risk for just some of those behaviors.
Now, you really want to talk about the area around our eyes. I'm shocked by this. I think a lot of people probably are. How are the eyes affected by skin cancer?
Right, so there's that delicate eyelid skin, and that tends to be skin that we don't always protect from the sun with sunscreen and sunglasses. And so that is really something that you don't think about, but the sun is still hitting. And in terms of locations, the lower eyelid as well as the inner corner of the eyelid tends to be the way that sun hits our face and tends to be the areas that we pick up skin cancers.
I mean, I never put sunscreen there. I try to keep it away from my eyes, as a matter of fact. So what should we be looking for then in the area around our eyes? I think a lot of people know to go get skin checks annually, but what should we be looking for around our eyes specifically?
So that's a great question. So really, it's the gamut of lumps and bumps, but even subtle things like redness. So as you can see in this photograph, the first photo was a very young woman who had just a little bit of redness on her cheek that ended up being a basal cell carcinoma. This is a lower eyelid with just some lashes missing, so a very subtle finding, and the patient came in. Now, in terms of, and then here's a little bump that we're seeing as well. But in terms of symptoms, largely these are asymptomatic. Patients aren't coming in because something's bleeding or bothering them, but sometimes they can. So sometimes there can be itching, bleeding, or irritation in the area. But really, it's just being aware of kind of what you're seeing that's new and different.
Okay, and maybe hoping that your eye doctor will catch it too. Yes. You say, but be particularly aware when you put your glasses on, like eyeglasses or sunglasses, if you feel irritation where your glasses fit on your face, that could be a sign of something?
That's right. So just as I mentioned, the sun's hitting that inner corner around the nose, and that can be irritated. And a lot of us would just chalk that up to, gosh, it's where that nose pad's sitting, and it's nothing more than that. But a lot of times that can actually be hiding an irritated basal cell or squamous cell, as that photograph just showed.
I think in the commercial break, we got to do a little scan here, Doc. That's what I think. What should someone do if they notice these symptoms or they're concerned in any way?
Yeah, so of course, we are happy to see patients in consultation as part of your routine eye exam, but also if you notice something that's changing and want to be evaluated. And the most important part of that is really looking under the microscope, looking for any suspicious characteristics, and then deciding with the patient if a biopsy is the right choice to get a pathologic diagnosis. And that's really the only way to know for certain, because we can't always guess.
Dr. Reddy, how often should all of us be getting checked for possible signs of skin cancer? Is once a year still the rule of thumb?
Yeah, so I think that once a year as part of a routine eye exam or skin check with your dermatologist, potentially sooner if you have a personal history or a family history, or if you notice something that's new and different and want to be evaluated.
Important information. Thank you so much for being here. Charlotte Eye, Ear, Nose and Throat Associates has 19 locations in the Charlotte area. Call Dr. Reddy. You can see her in Huntersville, Statesville, and Concord. The number to call, 704-295-3600. Again, 704-295-3600. Call that number to make an appointment or visit goodsenses.com, goodsenses.com. Again, thank you for your time this morning.